lead an educational session on a topic of which you have so much expertise, but then sat down to plan it and think, but where do I start? How do I transfer all of that knowledge I have up here into an engaging and instructional session for my learners? What if I told you there was a 5-step approach you could integrate into your teaching and session design endeavors to maximize learning, engagement, and retention among your learners? Hi, I'm Amy Gardner, Associate Dean for Faculty Development and Director of the Academy of Medical Educators here at the University of Colorado School of Medicine. Spend some time with Helen Macfarlane, Associate Professor and Director of Educational Technology in the Office of Medical Education here at CU School of Medicine, and borrow some of her evidence-backed strategies for delivering exceptional educational sessions.
Did you know that only 10 to 15% of medical knowledge is retained long-term when not actively applied? Today, I'm excited to share a powerful instructional model that can transform the way you teach and help your medical learners learn more effectively. It's called Merrill's Principles of Instruction. Whether you're a classroom instructor, mentor, or clinical preceptor, you know the challenges of engaging learners and ensuring they grasp and retain new information. By the end of this video, you'll discover how Merrill's Principles of Instruction can make your teaching more impactful and meaningful. Trust me, this is a game changer in medical education. Developed by David Merrill in 2002, this method is rooted in the belief that true learning happens through problem solving. This method is backed by research and has been proven effective in various educational settings, including medical education. Hello, I'm Helen Macfarlane, Director of Instructional Design for Undergraduate Medical Education and Assistant Director of the Teaching Scholars Program within the Academy of Medical Educators at the University of Colorado School of Medicine. I have seen firsthand how these principles can enhance learning experiences. I've implemented them in my own teaching, and I'm thrilled to share these insights with you. In the next few minutes, we'll explore what Merrill's Principles of Instruction are, how to apply them in medical education, and why they work so well. I'll also provide practical examples to help you get started. The first principle is demonstration. In medical education, this means showing your learners patient interactions, diagnostic techniques, or clinical procedures. Use videos, live demonstrations, or simulations to illustrate these processes. For example, when teaching suturing techniques, provide a video of the technique as pre-work, which the learners can watch and review multiple times. Then present a live demonstration where the learners can see the technique in person and ask questions to clarify their understanding. Next is application. Give your learners the opportunities to apply what they've learned. This could be through hands-on practice in a simulation lab, clinical rotations, or case studies. For instance, after teaching about the cardiovascular system, have students practice the exam on standardized patients or mannequins to reinforce their skills and to build confidence. The third principle is integration. Encourage your learners to integrate new knowledge into their clinical practice to solve problems. This might involve case presentations where the learners collaborate using their freshly acquired knowledge to diagnose and treat a patient. Or, for example, after learning about diabetes management, the learners could present a case where they develop and implement a treatment plan for a patient with diabetes, discuss the patient outcomes, and share what pearls they've learned. Before introducing new concepts, it's crucial to activate prior knowledge. Start by discussing what learners already know about a topic. If the learners lack the necessary background, provide it to fill the gap. For example, in a lecture on infectious disease, begin by reviewing basic relevant medical science principles. This prepares learners for new information and builds a strong foundation for learning. Finally, everything you create should be problem-centered. Present real-world clinical problems that require learners to use their new knowledge to find solutions. This approach not only engages the learners, but also guides them to the relevance of what they're learning. For example, present a patient case of undifferentiated abdominal pain and have learners work through the history, physical exam, differential diagnosis, testing, and treatment plan. Merrill's Principles of Instruction work because they are clear, concise, and adaptable. They give you the freedom to tailor your teaching to your learners' needs while ensuring that learning is rooted in problem solving, which is essential for true understanding in medical education. Now it's your turn to implement Merrill's principles of instruction in your medical teaching. Start by identifying a topic you'll teach next and plan how you can incorporate these 5 principles. Trust me, your learners will thank you for it. Let's make learning more effective, one lesson at a time.